when we're looking at all these incidences, the published amount of data is going to be different across the 3 neurotoxins that we've got available in Australia.
So you can't, and even though, yes, overall, the picture is looking very low, maybe 1 to 2%, yes. But when you're looking at each individual drug, you can't make any conclusions from that data. Or you can say pooled, that's what it looks like. Pooled, Niamh had it even less, like less than 1%. So pooled data looks very, very low. But I think because the clinical indications, the dosing and the drugs are all very different, you've got, if you're going to make anything more than an overall picture, you've got to break it up and compare apples with apples. And that's, of course, where this whole data thing falls down, because we don't have data in aesthetics.
No.
We have case reports and we have accumulation of case reports, but that's it. We don't have any good clinical studies prospectively whatsoever.
And to be fair, I guess, you know, that is a problem with complications and all of our clinics. Our patients hop around. They don't know what's in their face, what's in their body, what filler they had. They don't know when they had it. And I think this skews everything to do with aesthetics. It's not just resistance, but I agree with what you're saying, Niamh. But I guess it's the best evidence we can have. You know, meta-analysis is probably one of the best levels of evidence that we can have. So
of an overall picture, but not when you start to compare drug to drug, then it's very difficult, because like those studies, I know looking at them, the studies that were on INCO that were in there, they certainly were not excluding prior exposure. Okay. So it's very, and you've got this two-year window as well.
Well, we've got to also, we remember that, you know, and I'm going to go through the change in the amount of protein that was present in the old Botox vial versus the new one. I think the other thing that we've got to take into account is when each of the neurotoxins hit the market. Because if we look at it, the literature goes for at least 35 years with Botox. So this is what I got from my papers. Niamh, correct me if I'm wrong. In a period of 35 years, over 4,000 papers from Botox, around about 1,300. This is in the therapeutic arena. 1,300 with Dysport, 330 with Xeomin, and aesthetic in that 35-year period, around about 546 with Botox, 162 with Dysport, 77 with Xeomin. Because the other thing that I did is look at when each of these products were actually came on the market, because, you know, you've got a lot, 35 years. Botox got FDA approval in 1989. And the rest of Europe, you know, outside of the US, we've had it since 1990. And, you know, I've used it for 25 years. This sport's been around in the US since 2009, pretty much similar to Xeomin. Xeomin hit the US in 2010. And this sport hit outside the US since 1990. And Xeomin's been outside the US since 2007. So another thing I do think that we've got to look at when we're looking at all this data, and there's definitely a paucity of data, and especially in the aesthetic arena, I think we're all going to agree on that. But looking at, you know, when we're looking at all these incidences, the published amount of data is going to be different across the 3 neurotoxins that we've got available in Australia. Just the point.
Again, you have to look at just the papers that we're looking at, the papers on immunogenicity and resistance. So nearly all those papers, the majority of it was on clinical applications, not so much on immunogenicity.
Thanks so much for watching the video. If you want to listen to the whole podcast, go to your favorite podcast app and search for Inside Aesthetics.
If you like the videos we're putting out, please consider subscribing to our channel. Give us a like, smash the bell icon so that you get notified when we put out more content.
If you'd like to support us, our Patreon link is down below, and you can also follow us on Instagram on our personal accounts.